I'm going to share my screen. Thank you. We'll now move on to the opportunities for improvement. Okay, let it keep coming. I'll share the download at the end of the session. Over to you, Toastmaster of the day.
As far as we Toastmasters are concerned, every day is a wonderful day. But believe me or not, my dear friends, today it is a fantastic day for all of us. You know why? The first speaker was DTM Sundararaman Chintamani, and the next speaker is going to be Toastmaster, distinguished Toastmaster Karthik Mohandas. And he is going to present his level 1 project free speech on research and presentation. Before I could call DTM Karthik Mohandas, I would call upon the evaluator DTM Satish to read out the project objectives.
Good morning, Brackley's and esteemed speaker Karthik. Karthik is going to deliver his level 1 project 3 speech from persuasive influence path. His project purpose statement of his project is for the member to learn or review basic research methods and present a well-organized, well-researched speech on any topic. Timer, please note the time is 5 to 7 minutes. All the very best, Karthik, and over to you, Gopinath.
DTM Karthik Mohandas. Karthik's Believe It or Not. Karthik's Believe It or Not, DTM Karthik Mohandas.
Recording started. What happened to the solemn promise when you took that Hippocratic oath that I will lead my life and practice my profession with uprightness and honor? I will hold myself aloof from wrong, corruption, and temptation to others to vice. When Amir Khan spoke these words with aplomb in Satyameva Jayate, I was thinking, wow, he's a wonderful actor. And I'm sure the TRP rating of this program is going to increase. And also, he justified the colossal currency he was paid for. That is what I was thinking at that point, until I met a PRO from a laboratory walking into a doctor's cubicle and gave a check. And doctor is a friend of mine, and he looked at me and said, these guys never miss the date to give the commission on time. For every reference for the laboratory, doctor is getting the commission. You believe it or not, it is happening. Good morning, fellow Toastmasters and guests. You believe it or not, for every reference doctor gives to the laboratory, minimum 40% commission is given to the doctor. And in the laboratory, they need to recruit a pathologist, hematologist, lab technician, and chemicals, and they already have equipment and GST for that. Considering all that and giving 40% cutting to the doctor, I don't know how they are executing the test. And that is what mentioned in Satyameva Jayate. He was telling that test is called basin test. We'll pour the test samples into the basin and we'll give the report as doctor recommended. Sugar in traces and everything is normal. And that report was given to the doctor, and the doctor is going to treat for the report which is not tested upon. Oh my God, Karthik, we cannot judge with one scenario and one laboratory. There are good doctors, sincere doctors, and good laboratory. You can say that. But let me ask this question. Say, imagine you have 10 worms inside your body. I'm sure worms will not be there inside your body. For our discussion's sake, let's have 10 worms inside the body, and it is swimming in the blood, and it is swimming across the blood. What is the function of the kidney? It is in our 6th standard syllabus, science syllabus. What is the function of the kidney?
To purify the blood.
Yes, is to identify, segregate, and eliminate the waste through urine. And what we do, we take our urine and go to the laboratory for giving the test. And I'm sure they are conducting the test, and they will tell you 10 worms we found in the urine, and they give the report, and we take that report and go to the doctor, and doctor say, where is the worms? Where is the worms? Worms is in your body, and I have to give antibiotic for the worms, which kidney has performed function properly, and it is doing its duty and eliminating the waste, and doctor gives the antibiotic for the worms, which is already out. Do we need to do the test on the margits which is going out of our body, like urine, stool, phlegm? Do we need to do the test on that, and do we need to believe that? Ask this question to yourself, and if we ask this question, and we'll be illogical. Okay, so there are tests happening in the blood, and what are you saying, Karthik? I have one book which I read. There are a couple of books I read, what doctors don't read in the medical college, and the other one is what is happening inside the laboratory. Okay, there is one guy who went to all the laboratories between 7:30 to 8:30 in his town, and close to 5 laboratories, and gave the test of his blood sample for testing hemoglobin and WBC level, white blood cells. And the report says it varies from 5,600 WBC to 11,100. And for hemoglobin, it varies from 11.9 to 14.5. 5 laboratories and 5 tests, and it has got complete variation. And that is what doctor is going to get. I don't know which one we are going to treat. And we cannot go to the court and sue them for there is a difference in the report, and we cannot go and sue anyone, because WHO and the medical fraternity say every moment our body is accustomed to change for internal and external factors. If that is the case, then what is that you are treating me for the report which was done yesterday, and giving the treatment, and my body is going to change every minute for every factor. What is happening inside? Liver, kidney function changes, and walk, run, my physical activity, mental activity, everything body changes. Then why you are giving the treatment which is done before? And there is a variation across the labs. Every minute is changing, then why you have to do it? Before we go and give test, ask this question to yourself, is it really required? And even if you do the test and go to the doctor and he suggests something, and before we proceed, ask this question to yourself, is it really required? And I have one patient, I'm practicing acupuncture from past 1.5 years. I have one patient who walked up to me on Wednesday, having an appointment on Saturday for a surgery in his heel for varicose vein. There were a lot of tests were done, and they have identified you need to go through the surgery, or else we have to amputate your leg. So that is the kind of scenario. And he came to me with all the reports. I told him, postpone your surgery for 3 weeks, and I'll give you treatment for 3 weeks. And if you don't see the difference, you can go ahead and try that for 3 weeks. Wait, and after 5 weeks of time, that gentleman has got cured. And what he did, he took that image and posted in WhatsApp and saying, thank you so much. I would have went to the doctor and gone through all the surgery, all that. So that's what he did. And I in a week, I handled close to 20 patients. And this is one of the patients where we see the external injury and it is got cured. So before we believe anything, And this is one of the book I would recommend, what is happening inside the laboratory. It has given everything. And also go and watch this Satyameva Jayate, Life is Precious, 1.5 hours. It reveals everything. Before make any decisions, believe it or not, try that and believe it, and then go ahead and do it. Over to you, Toastmaster.
That was a Believe It or Not speech, and also a mini book review by Karthik. Shall we go on to the Mentimeter voting, Ashok?
Yes, yes, sir. It's on the chat window.